Kyla MacDonald. Thank you so much for being here.
Thanks for having me on, Brandon.
Yeah, no
Uh,
worries. So just real quick, if you'll introduce yourself, I tried to get the information from you, but I want to make sure I get it out correctly. So that way everybody knows who we're speaking to and all the qualifications that you have. So I'll just let you introduce yourself.
Excellent. Yeah, so I'll start by saying the credentialing or the schooling that I've done, I the ones that pertain at least to nutrition. Actually, I'll back it up. I've got an education background, so I've started as a with my undergrad in education and went on to be a high school teacher for a few years. And I think that that's important to say because it's kind of the background of being personal with clients and understanding the engaging materials that can make things applicable to student or client. But from there, I realized I really wanted to specialize. So then I went and grabbed my master's in nutrition at the National University of Natural Medicine in Portland, Oregon. Um, and then from there was clinical hours that followed into getting my credentialing, which was a certified nutrition specialist. It's, I guess, would say it's pretty equivalent to a registered dietitian, although, and that is a great credential to have and see registered dietitians. This is a little different because my credential requires the master's degree. And then I do have licensures to practice as a licensed dietitian nutritionist in North Carolina, and I work at Thrive Clinics.
There you go. And thank you for that because I wanted to make sure we capture all that because today we're going to be talking a lot about uh, nutrition and health. And we just want to make sure that everybody that's listening knows that you're getting quality information. This is actually my nutritionist. So I meet with her quite frequently to make sure I'm eating healthy and doing things that are healthy for me. Just a quick note that while we are going to have a general health conversation, anybody that's listening, don't just take what we're discussing and just apply it to your own life immediately. Work with your primary care and your own personal nutritionist. You can use her if you want to. She's really great, but you need to work with them to set up the best plan for your health because you may have specific goals that you're trying to meet, whether it's weight or coming off certain medications for things. So you just want to make sure you're doing that in a healthy way. So don't just listen to what we say and then take it as gospel. Work with your doctors. First question. So earlier in the week, we did a post on social media asking, we said, hey, you're coming on. Does anybody have any questions for a nutritionist? And the first question I got was, what are some things that people can do better for sleep?
Love the question. It's a good place to start there because I think just highlighting that, Brandon, is that even clinically working with patients, we always screen for sleep. So that's also another indicator. If you're looking to work with a health coach, if they don't ask you about your sleep, that's like one of the pillars that's going to make a big difference. Of course, respectfully, everyone's coming at sleep hygiene differently, meaning season of life. Are you do you have kids that come into the bedroom that might be a disruption? Do you have pets that are, different needs there? Do you have a partner that works shift work, or are you working shift work? So these are all obviously vulnerabilities that may make sleep challenging, but nonetheless, there are tactical things that you can apply no matter what season of life you're in. I would say, and why it's important, I guess, to establish is that if you're looking to improve your nutrition status, sleep, there's great evidence to show that when we don't have enough of it, we are, and maybe symptomology, people can explain or can experience this for themselves, we're more likely to make poor choices, both in cognitive function, in any area of your life, but as it comes to dietary changes, you're more likely to be craving sugars because your blood sugar is less regulated without sleep, or at least proper sleep. So this is our recovery place. So how to get more of it? I would say this is where I'll let Brandon kind of elaborate on further questions that may be the undertone of this. But what are your habits before bed? What is your transition cues? So think about sleep like the way that you might parent or the way that you think about your childhood is it's really important to have structure. So allow yourself maybe, I mean, optimally maybe like an hour to transition. It could be it could be like as the sun is going down that you're very mindful in your house. How bright are your lights? That can help set the tone. So if we've got really fluorescent lights, we've got the TV screen going on, and you might also be engaging in amongst your work and phone. Can we be putting dimmers on there? And I think actually Apple has even a black and white monotone thing that you can put on your devices. I mean, variable quality data on whether blue light glasses are effective. I have them, but I think what matters is kind of just like the overall exposures of bright lights. So set up your bedroom that way. I would say that people get it wrong is they have a TV in their bedroom. So I would try to eliminate the environmental factors with having a TV in your room. Enjoy your TV, put parameters on it just like a child. So maybe your TV is you're watching episodes on weekends as a family rather than it being like your regimen every night. Or if you do have a habit of TV to help unwind, you know, bank on it early, maybe around dinner rather than leading right up to the moment you're going to shut your eyes. Um, I think um, the other thing with the phone is kind of another thing that's going to keep your brain stimulated would be, if possible. And I know that there's parents out there that they want to have the alert of their phone in case their kid's out of the house. But if there's another place that you can put that phone in the bathroom, plugged in with a sound on it for you if you need it. Otherwise, if there's no reason right now to be having the phone, just plug it outside, get your analog clock to wake you up. And another tip would be like if you're gonna be using your phone in your bedroom, you have to do it standing. And so that just challenges the default to like get in bed and then doom scroll. And I think the terminology there is like revenge doom scroll related to your sleep. You're just before you know it, 2 a.m. Right? You're on your phone.
Yeah.
You're like, how did we get here? Um, so I think parameters on devices would be like the strongest like starting step, and I understand that we all have different attachments there. I'll just take a breather and pause in case there are like iterations or other questions that you want to dive into beyond the screen because we could really dial into this topic if we want to continue.
Yeah. So one thing that Sarah and I started doing is we've started that nightly routine. And so I'm going to tell you two things that we do, and you let me know if that's good or bad.
Yeah,
I'm sure you'll say it's good, but like in moderation or whatever.
sure.
So at 9:30, we try to go to bed around 10:30 at night. So at 9:30, we've started drinking chamomile tea.
Nice.
Um, it it's funny we call it our tea time, and I'll make us 2 cups of tea, and we'll sit here, and we'll still be watching TV, but
Mm,
we'll have our tea, and it starts to like wind us down. And then at 10:15, when again my Apple phone says, "Hey, it's bedtime, time to start winding down," we'll take magnesium,
mm,
and I forget how much we take, but it's just the little chewy ones. And we take those, and then 30, 45 minutes later, like we're out. I know in the military, when you go in and say, "Hey, I can't sleep," it's, well, here's your Ambien, here's your, I don't know, all the different sleep medicines, but I never felt like I was getting a good night's sleep. I felt like I was just being
mm.
knocked out.
Yeah, and
So,
truly you are. Actually, I will say on that medication note, the research there is showing you're not actually getting sleep, you're being sedated. So it's a very I understand that that's a military prescription to
yeah.
make it through, but totally different experience on your brain in that just highlighting the medication use versus proper sleep.
So I'm sure that there's a lot of people out there listening that are like, they might be on the Ambien or the Lunesta or whatever those other sleep ones are,
Mhm,
or they're self-medicating. I used to self-medicate with alcohol. I would drink
mhm.
just enough to get tired and then boom, I'd go to sleep. Um, so is the tea a good thing? Is the magnesium a good thing? If yes, great. You can give me some praise at our next appointment. But what are some other things that people could be doing naturally to help their brain and bodies wind down for bed?
Yeah, this definitely helps me to launch off on some other areas, which is nervous system, right? Stress. How do we cope with the day? And often I will say again, the evening is the most vulnerable time for people because that's when the day catches up to you. How did you manage stress that day? It's going to show now in the coping skills of substance use. food addictions, sugar, all of that can be calming for the moment, but you're right, they do lead into pathways that will keep your brain more stimulated or your blood sugar dysregulated. So before you know it, maybe now you're up in the middle at 3 a.m. because again, the nervous system, cortisol, dysregulation, all these things that were from a lack of stress mechanisms. So the tea, I love that because we have herbs, whether through tea or other herbal supplements that you could work with a herbalist or a nutritionist to kind of find um, the right herbal balance that works on the nervous system. So that can there are things that are called adaptogens. So outside of chamomile tea, there can be things like the mushroom adaptogens or yeah, L-theanine, which is like the calming adaptogen within green tea. Wouldn't recommend the caffeine or green tea before bed, especially if you're very sensitive. But the idea is you can meet your nervous system where it's at through herbs. Um, so yeah, a transition like that is thumbs up, a really great transition there. So I guess that the inverse of that is caffeine too. So I'm not about to preach to not have caffeine, but try to be mindful about the time. So it takes on average maybe 8 hours to metabolize that caffeine out of your system on average. So some people are a lot more sensitive and maybe we're not having just one cup. So think about if you're maybe going past 12 p.m. That will probably, delay the sleep onset, especially if you're hoping to get to bed by 10. Um, so yeah, ruled that all out, and then the other latter thing was there another thing I missed on your habits? So we talked about well, magnesium, that was another
Yeah.
thing you brought up. So yeah, I like magnesium in my toolkit. I would say where it's most effective is if you're deficient. So as it as it pertains to sleep. So its mechanism of action is that well, it does a lot of things in the body, but specifically it helps with muscle contractions as one aspect. So if we are in a deficient state, some of my clients who are deficient, they might get restless leg syndrome and that keeps them tossing all night. Or they may have signs of maybe they're on a low carb diet where we're excreting a lot more minerals, so they are magnesium deficient if they're not being mindful, and so that actually might create insomnia. Or even if you're maybe not on a low carb diet, you could also have insomnia related to magnesium deficiency. So I wouldn't say in isolation that magnesium is the nutrient that will help you fall asleep, but if you are deficient in it, it is gonna keep you awake, if that helps to define that. Yeah.
Well, I know I had the full blood panel done up,
Mhm.
um, and I think I was deficient in magnesium because I told you I took it every single night, and you were like, "Oh, that's good because you're already low in that." So that
Yes.
explains why it does start to make me drowsy right around the 30 to 45-minute mark.
Yeah, and
Um,
there's a relaxing effect too, right? Which is like that body maybe, intensity or like not noticing like how stressful the day is. So there's that actual physical manifestation of relaxing the muscles, which can put someone in the right mindset to be like, I'm relaxed enough to doze off. Like I can let go.
gotcha. And
Yeah.
speaking of the testing that I did,
Yeah.
um, so the testing that I did, and I'll let you explain briefly the difference, but I did like a full blown testing of like, I think they took 8 vials of blood, urine, saliva, and sent it off to be evaluated. But I've talked to some people that I'm like, you should go see a nutritionist. They could really help you. And they're like, oh, well, my doctor did blood work and said everything looked great.
Mhm.
What are the differences between the in depth that I did and just your primary care doing a normal blood draw and checking you out?
Excellent. Great question. I would start by saying like let's talk about the common tests that you would get at your doctor's office. The gap here is really that not to obviously bash medical or like conventional medical systems, but they are at a crunch for time. And so why maybe going to a nutritionist or someone that works within a functional space, we really have the allotted time. So we're with our patients, we're screening them first off for up to 90 minutes, and then follow-up care is an hour. So we have a lot of time to really see, like, did your doctor test this, this, and this? And usually here are the common things that I notice in conventional care. We either the doctor is able to do physical or yearly exam, maybe there's a blood draw in that, and it would likely be just a complete blood count. Like, how are you doing with yeah, your hemoglobin, the quality of your red cells. What about your white blood cells? Do we have infection? To some standard nutrient panels in there, there might be, if we're lucky, we'll have a vitamin D in there, but doctors are not always getting that done. And if we see a deficiency, sometimes someone will say, yeah, I was low in vitamin D. That was tested, but it was like 2 years ago. And so we have no idea if it's been addressed. So also like noticing, is your doctor following up on after there was a deficiency or abnormality in any of this blood work, did it get better? And sadly, the patient is the one that's really going to have to advocate in that mainstream care. Um, but most often the doctors that aren't being sorry, we have a primary care at our clinic as a functional clinic. But if someone is seeing a doctor conventionally, often there's a good relationship to request that certain labs. So some of the things that would be great to get would be, if not done routinely, is your iron panel, your thyroid panel, which may not be the comprehensive one. So that's a key word is comprehensive thyroid panel so that you can see the T3 and T4. Um, what else is most standard there? Maybe sometimes we get the B vitamins in there that can be telling, especially with B12 and folate. And I probably your lipid panel and metabolic panel. So just to kind of check things on cholesterol, and how your blood sugar is doing. So what's a little different then would be we want to really follow that obviously because metabolically, if there's some changes, there's risk factors for cardiovascular health, your mental health. With we'll get into this, but actually a key factor here is how your blood sugar is doing. That can be kind of the pre-warning for a lot of onset of inflammation. And what we do a little differently, I guess, in all of that workup is again the following, the monitoring, and potentially advocating for things that aren't usually routinely on there. But if you're going to work with someone functionally, we are offering tests that are typically not covered by insurance at this point because you always have to prove the medical necessary component, and not everyone, yeah, we just don't apparently don't have insurance recognizing that yet. Caveat in maybe bringing scenario is that TRICARE, if you're working with TRICARE, we actually are starting, it's the only insurance company we're starting to see some coverage, like the organic acid test that we're about to talk about, but among also stool tests. And there's a couple of accounts out there in the military community that are explaining actually how to use TRICARE. So I would, and maybe we can get that in the show notes, but there are people that are doing a really great job explaining like you can get this covered. It's not a guarantee, but if you've got medical criteria, you can likely get it covered.
So
So
when
go ahead.
when I did the test, you had told me, "Hey, we want to do this. TRICARE may or may not cover it." And I think it was like you told me it was going to be around $400.
Yes.
But TRICARE did cover it
Oh,
because it was
excellent.
based on my post traumatic stress, my TBI, and that you guys were trying to figure out what's going on with me mentally and physically. And I had the stroke and all types of
Yes,
stuff. TRICARE covered 100% of it. And then you were able to look down almost at the molecular level of everything that was going on in my body.
that's right.
Um, and so it was really great and helpful.
Yeah, and so if your audience is TRICARE, dominant, I would just say work with a provider to get all those like the what you're looking for is specific medical diagnosing criteria that you can provide your insurance. So if you work with a provider, maybe they're submitting it for you, but it's for this test, the organic acid test, the oat test, most specifically, actually, we did the Nutria eval test by Genova. It's a little different. It's actually a more even part 3 test to a note test. So just to go in the weeds of this, it's a little bit more comprehensive, and that's why you did a lot of things to provide in the kit. So all that to say, if you've got the criteria there, the best candidates for coverage are nutrient deficiencies, which you could probably draw from your conventional provider if you have those. Yeah, any documentation of mood. So, example, PTSD, trauma-based experiences, those all impact, yeah, your nutrition status, but also investigating what's happening on those pathways for mood. So there's another, bigger list, but that's kind of the top candidates that are probably going to get covered for that type of test. And I'll pause by saying the last thing about the test is the Nutra-Eval test. It's an oat test, so it's a urine test that will test your um, metabolites. So all the so I guess when you sample the urine test, it's going to be able to analyze all the steps that go into making energy, your metabolism. So it's like the breakdown, the metabolites, all the things. If you're missing somewhere in that, you know, it's like an organic biochemistry set. If you're missing something, or you're getting a traffic jam in going on to make energy, ATP, or going on to make neurotransmitters like serotonin and dopamine, we're going to actually see that in your step-by-step process. Like, where's the traffic jam? What are you not getting enough of? As well as inflammation markers and even signs. Even though it's not a gut test, there'll be signs for neuroinflammation or gut-related inflammation that might be like, this is also a good cause to potentially later do a gut test based on seeing these like inflammation, fungal things in your urine. Um, and it provides the omega-3, which is your fatty acids, super essential for brain health and your immune health. And that's a little bit different. If you just do an oat test on its own, you're only going to get the urine sample. You're not going to get the other components that assess for your fatty acids. So a little bit more than maybe the audience needs to know, but we can, link the test so you can read about them.
What I thought was great about it was, when I came to you guys and started working with you, a lot of the issues I was trying to figure out was, aside from why did I have a stroke at 42 years old, um, facial numbness, some of the very like weird specific things, um, mental health, depression, anxiety, stress. Uh, you guys can't fix my physical stressors unless you want to take some of my kids. I'd be happy
Yeah.
to drop them off. Um, but when you looked at that panel, you were able to see certain things were too high, too low. And then I remember like my B12 was super low, and you said that could affect, I think it was depression.
Yep.
So my question is, how does gut health and mental health really, work together?
Absolutely, yeah. There's probably like broader categories that I think help to define how complex the said word now, gut microbiome is. So if it's a word that is probably more in the media than ever, what it just really means is the diversity of bacteria. So we're made up of trillions and trillions of bacteria. We have so many of those bacteria that live in the lower part of our intestines and the colon. And that dictates, actually, it's the home to production of, like, let's say 90% of things like serotonin and dopamine. So they're made there. As well as it's like the gatekeeper to your immune system. So the gut lining, and then so think about, I guess, your digestive tract from mouth to anus is kind of like a donut. So we think about, there's this pathway, and there's lining of the that intestine all the way through. Now, near the part where we want nutrient uptake, we actually have a gut lining that is selectively permeable. So, meaning we do want to, uptake glucose or blood sugar, and we do want nutrients that pass through. We don't want bacteria that's pathogenic. I mean, we just don't want bacteria to be going into the bloodstream, and then where is it going to end up? Inevitably in the brain. So, whether that's yeah, bits and parts of the stool that shouldn't be there. That's how we develop some allergies, because now your immune system's like, "Whoa, what's that?" You know, that shouldn't be frequently crossing over, to whether it's something called like endotoxins, so just exposure from environmental toxins, to pesticides in the food, to mold exposure. Wherever these toxins are coming from, we can obviously name an abundant avenue, but what they're getting in the bloodstream, and that's gonna just create this bigger systemic inflammation, that your immune system's overly reactive, and then we have more pressure, of course, in the brain area, that those same toxins, if they're in the bloodstream in your body, they're gonna end up in your circulating bloodstream in the brain area, which does put, yeah, a lot of pressure to deal with that and protect the brain as much as possible. So that's one avenue is that I guess the gut barrier immune system is a big piece to mental health. So I guess circling back to the are we getting enough materials, first of all, to go and make the things like dopamine and serotonin and GABA, the things that help us fall asleep, the things that help us feel good, and support cognitive function. So part of that test, the oat test too, is like, oh, very commonly is sometimes just under eating in protein, so amino acids. So we don't maybe have that. It also could be the bacteria that actually are responsible in the gut to help um like they're the that those bacteria are all sorts of jobs that I guess we didn't realize, but they help to communicate to the brain by via taking something like tryptophan and then creating a byproduct, or I guess the precursor of that to go and make tryptophan. So if we actually don't have the right bacterias living in the gut, we're not making tryptophan. We're not making these bigger neurotransmitters that go and it's like a highway. Like the brain has let's call them like the vagal tone. Uh, the brain or the gut actually has got like a three let's call it like a 3-lane highway to the brain. So which is why we always think, oh, intuition in our gut. I sense something. Well, literally, these bacteria and the vagal tone are communicating to the gut or the brain all the time, and the brain also talks back, but it's like a single lane going down. And so you can just see how much impact the gut has. So if we're eating sugary, processed foods that lack protein, that lack the vitamins and minerals that help support these pathways, you can just see how much inflammation we're getting through these channels, and it just purely a down regulation of the things that we need to produce because we don't have the materials. And from the point of bacteria, we may not have the right bacteria that are there to do its job to make more things like tryptophan, among other things. So then, so the reason why might be antibiotics. It could be obviously the way that you start life from the microbiome that was seeded by your how you were born into the world. Um, Again, poor diet choices, stress too. So there's a numerous reasons why we might not, but the good thing is it's very adaptable. So there's interventions at play working with a nutritionist that you can um, improve the gut health. And then you could also use obviously that organic acid test to see like what are you low on and where can you start, maybe even just from a supplement place or reinforcement that your diet needs to shift to get the right materials to be in there as well.
So I have a question, and this is going to lead us definitely into the point of nobody do anything until you talk to your doctor.
Yeah.
Um, so being in the military, traumatic brain injuries, my brain is off, from concussions, everything else. So I get depression, I get anxiety, I get all these things. And then my doctor is just like, here's a pill. Take this pill and you won't be anxious anymore. It'll fix whatever.
Mhm.
Um, Now, for me, when I got out, I worked with you in Thrive Clinic. I was like, hey, I don't want to be on medicine anymore. And we've developed a program and a plan to like help me regulate my blood pressure, my anxiety, all the things through. I'd rather take 6 supplements than 6 like pharmaceuticals. And that's basically what I do. Um, I had a squirrel moment. See, this is that TBI. I forgot where I was going with this. I know where I'm going with it, but I'm not going to be as clear as I thought I was going to be. Um, what are some things that we can do if people are dealing with the post traumatic stress symptoms of like anxiety and depression, all the mental health things, but they're just being pumped full of 10, 15, 20 drugs a day to regulate their emotions? What are some things that they can do after they go work with a primary care and nutritionist to figure out what they're deficient in?
Yeah.
Um, what are some things that they can do to start combating from just a healthier standpoint, that mental health?
Absolutely love that question too. Well, let's say full support. If let's say in this triage of like support is that you got your primary care, now you've got your dietitian nutritionist on board, not to be remiss, and I know it takes some time to find a good match, but I would also say if your psychiatrist is whoever the prescriber is more just like, hey, I'm going to give you this medication, but we're really not going to have talk therapy with that. I would recommend finding good therapy support because we just, all of the mental health conditions that you listed, it's hard to navigate life. So I think to truly have that support medically is necessary. Also see if medications are appropriate based on day to day, you know, reportings of symptoms. So if that's not added, I would definitely recommend that. In terms of the nutrition lane, what can you do when we're on a lot of medications? Actually, this has become a very passionate topic for me. Is what's lesser known, the gut brain connection. We've just slightly touched on huge impact, right? Because of the lack of nutrients coming in that compromise that pathway. Lesser known related to mental health is how is your blood sugar doing? And why that is really important is because it has a lot to do with, is your brain getting energy to it? So let me paint you a picture. And this is where it's like sort of more of a silent cry, I guess, or a silent condition where we have known mental health or for whatever the root cause of, it's manifested. But what's going to exacerbate that and make those medications continue to be a set of 20 or more, or that they be, just aren't that effective long term, would be how is the blood sugar doing? Because if blood sugar continues to creep up, meaning we've got about 5 liters uh, of blood circulating in a healthy state, about 1 teaspoon of blood sugar. That would surprise people. So that's like a 80 milligram per deciliter blood sugar, fasting blood sugar reading is 80. So I'm talking about if your A1C is creeping up, like traditionally, I think prediabetes, like over 5.6 and over. You're waiting for that to happen. Some people might have mental health manifesting and their blood sugars are kind of testing water. Like maybe the fasting is over 100 milliliters per deciliter or milligrams per deciliter. And what we're not measuring is insulin, which is like we're waiting for all this blood sugar to get bad. But what's happening with insulin? It's working really hard to keep your numbers in check, meaning to keep them lower even though you're not feeling your best. So that's kind of that's why it's hidden, is that this insulin, how is it getting high? That sugary carb standard diet is going to need insulin to help it get out of the bloodstream. Remember, we want that 1 teaspoon floating around. So when we go to eat something that's more than 1 teaspoon of sugar, and that means sugar, not just the white sugar, it's the things that turn into sugar, the starch, the potatoes, the rice, the grains, the bread, the desserts, etc. Think about how much sugar that would be, per things like even a Starbucks drink. There's so much sugar. So your body is working so hard to get back down to baseline, which means we've got too much insulin, and then insulin, whose signal is to say, hey cells, take up this blood sugar. We've got too much in the circulating bloodstream. The brain is the conductor here and is saying, hey, there's too much. And if we don't control this, there's going to be too much blood sugar around the brain, which is also where we get inflammation. Um, and so the story goes on. We get something that's called insulin resistance or hyperinsulinemia, which means too much insulin. That is an inflammatory state. So too much insulin in the body means too much insulin in the brain, which means that you become not effective at putting blood sugar into those brain cells that need it for energy. So that little furnace in each cell is called a mitochondria. You're not getting blood sugar in there, cognitive impairment. Can't think of words quickly, we delay, we're really not getting energy efficiently. And so you're in a neurotoxic or neuroinflammation state around the brain with a lack of energy, fatigue. If we let this go on, the manifestation of that, or we're in the scarier cognitive conditions of Parkinson's and Alzheimer's and all of these things related to metabolic. You can just see like, oh, that's with age, but actually the dictation of that is how are you managing your blood sugar now as an adult, a child, or middle life. And so I would say the most exciting research right now around that is talking about insulin and blood sugar to support people getting energy to those cells. And I'll talk about what are those interventions. And with those interventions, we're seeing people reduce reliance on medications. So that being going from 20 to maybe 3 to maybe getting off of them, but doing it in a very supportive way. And potentially also just seeing those medications more effective because we're actually talking about we're the root cause of being in an energy deficiency around brain health. Um, that's a long-winded way of saying that metabolic health is extremely important for making medications effective and maybe getting off of them.
That was one thing that we've seen around here because Sarah, my wife, she pays a lot of attention to my moods and my mental health because she wants me to be healthy. And she is a health freak herself. And I mean that in a very loving, respectful way. Um, but she has noticed, working with you, we've talked about I don't get enough protein.
Mhm.
I don't eat enough. It makes me feel foggy. I'm just not as healthy, not as happy. Um, she has noticed that if I miss my supplements, which I take B12, NAC, I forget everything right now. Berber, Barberine,
Oh, yeah,
berberine.
berberine? Yeah, I can't
Yeah,
recall that one, but I know, like, let's say your Bs, your
yeah,
omegas, I know
yeah.
protein.
Omega 3, red
Yep,
yeast rice, stuff like that.
that's right.
And then a multivitamin, and I drink a protein shake every day with like fish oil and some other stuff.
Yep.
And if I don't do that, I'll start to get bummy and just kind of like, I just don't feel like doing anything, like, woe is me type of thing. And she's like, have you taken your vitamins? No. Have you had your protein shake? No. Have you eaten anything today? Well, a handful of hot tamales and, energy drink.
Yeah.
And it's like, that's your problem. And she's right. And I've seen a difference. And so it's helped me be more consistent. Um, but yeah, here I am taking an antidepressant that's not working
Mm,
for 5 years. And the side effects of like forgetting to take that pill are much worse than forgetting to take a multivitamin. But yeah, like I'm much happier now. I'm clearer minded. And all I'm doing is just making sure I'm eating enough red meat and taking a multivitamin or whatever it is that, I was deficient in. Hey, funny story,
mm.
by the way. That blood work was so detailed, you were able to identify that I drink too many energy drinks
That's
because
right.
my taurine levels were off the charts. You're like, everything is really low here except for taurine. And I was like, well,
Right.
I may have had an energy drink every single day leading up to that test, but
Very cool.
I digress. Um, yeah. And, I know some people don't have a problem with medication.
Mhm.
I just didn't want to I don't like being tied to something every single day for the rest of my life. Um, and again, this is why I wanted to have you on because I just feel like this is so important because it's helped me so much just living a happier, better life, taking a vitamin and eating healthier than putting whatever chemical formula into my brain that's not actually addressing the root cause. It's just masking it. And I've
That's right.
realized I've gone on a soapbox. And I also realize we have about 10 more minutes until you have to run.
Well, if I
So
might just connect to your offering, because one, I think it's so beautiful that you're actually being able to experience these changes, right? It's not like a placebo effect that you're implementing, and that's the conversation to be had with whoever you work with is how are you feeling now? If your provider is not asking how are you feeling now, what about how did you start? We might miss some of the small victories in that care change that either we need to continue to adapt to find a better degree of nutrient support that you might still be deficient in, or looking at your lifestyle as well. So I think what you've been able to speak on is that not only are the nutrients important because that matters in we call these cofactors in nutrition biochemistry. They go on to create, energy. But if we don't have the nutrients, the vitamins and minerals, we're not creating those lighting up those energy pathways. But also, you spoke on I forget to eat. So another component to this organic acid test is we often see in the interpretation of it kind of the chronic undereaters. And I think you can provide a lot more context to your audience, which is people of military service might not have the opportunity to really care for their needs. So we're in this uh, simulation of substance use, right? Overcaffeinated, and then we deal with the stress and the overcaffeinated with something that's going to create a downer. So then, whether it's the carbs or the alcohol, and so it's this like vicious cycle, but we're not getting actually energy from vitamins and minerals and from regular blood sugar, meaning consistent eating patterns that lead your brain to calm down. Like we're not in a panic that our blood sugar is dropping, that we don't get energy. So it's a combination of both is like eating enough, eating consistently and getting, the materials. So I just wanted to wrap that up from the lens of seeing that for you, is that here maybe a prescriber is missing that because 'cause they're just like, "Oh, you're in a low serotonin, dopamine state, like, let's just hit those and give you a bit more of that, with this drug," but we're not seeing actually the string of things is that you're not getting enough energy in your day-to-day life.
Yeah, and, there's some days it doesn't matter if I take my vitamins and eat 3 steaks in a day, like, some days I just have a day,
Yep.
and that's okay. Um, but yeah, my normal day, and you and I have talked about this a bunch, uh, 2 cups of coffee in the morning. If I eat lunch, I'm doing good, and then I just have dinner, but I eat a good healthy dinner, and that's just not enough, and, the lack of protein, you said it's not literally, but literally killing me, um, or maybe literally, I don't know. But, yeah, I just don't eat enough, and I think that comes from, just how I was in the military. It's like you're up and you're doing PT at 6:30 in the morning, and then you're done. You have enough time to go back to your room, shower, go throw down some food, but it's not like it's fresh eggs. I guarantee they're probably like powdered eggs or whatever.
Yeah.
Or if you're out in the field burning thousands of calories, doing whatever training event, you're eating an MRE. And I don't know how healthy those things are, but the fact that they're shelf stable for like 20, 30 years, they can't be that great for you. Um, and and so I just got in a habit of I said for a long time, like I live on caffeine, nicotine, and hate. Like I'd wake up, I'd drink coffee all day long, I'd keep a dip in back
Mhm.
when I used to dip. And then at the end of the day, I would drink until I went to sleep. So I can't speak for the rest of the military, but I'm sure there's a lot of people out there that are living that very similar, same lifestyle. Because I wasn't the only one that said that. But yeah, I think it's all about eating healthier and just being healthier. And I do recognize that like my brain is not a normal brain anymore from head injuries. Like I recognize that there's physically something that's probably different. So it's not like, some people may need to take the medication just to make sure all the connectors are connecting. Um, I've just noticed such a huge difference and a better difference working with you guys. That I just wanted to help spread the word and encourage other people to find a nutritionist such as yourself that actually listens. And our first session, you said, "What are your goals?" And then, we got another one on Wednesday. This one doesn't count, so I'll still see you on Wednesday morning. Um, but I know the first thing out of your mouth is going to be, "So how have you been? What are you wanting to focus on next?" And I just think that's so important because there is help for people just by eating healthy and getting our body chemicals and chemistry back in order.
Absolutely. Yeah, it's not, and meeting you where you're at. So there's a lot of tools, and so Brandon's had the agency to say, okay, there's a lot of things that we could do, and there still will continue to be a lot of supportive things. But what matters most is what's most empowering is what is going to be something that Brandon can implement in this phase of life, and we're going to identify that together. And sometimes we don't, maybe we won't get that right, or we want to make sure, or we want to provide the experience to choose, and if it doesn't work great, it's not that, that is the only thing we have, and it's like, "Okay, see you later," and that might be the case for a lot of medical, interactions is like, "That's all we've got for you," but we've got a lot more, and it's great too if you have a provider that can work on other avenues outside of nutrition, lifestyle, sleep, exercise, so there's plenty of that other things that we could and go dive into today, but I would say, that's what's beautiful about that is there's a lot more that you can integrate when well, I guess this is a good necessary point to end on, is that when you do have more bandwidth, say maybe it is the supplements we start with, and then you're starting to get the necessary backbones of what you need, like the for foundation of your pathways, then now maybe there's, an expansion to kind of move on to other modalities, because you have better bandwidth, right? It's like, "Oh, I can now think about this," or, "I have space in my life because I have better energy, so I can think about exercise now," or sprinkle it in. So yeah, I think meeting where you're at, meeting patients where they're at is really important, and, the other key piece, I guess, with mental health is trying to make things simple because we already know that depending what condition, it may be difficult to implement and remember, and so whatever the simple is probably it might even sound embarrassingly small of a step, but it's probably a good reminder that, like, um, you needed that coaching or that accountability, that you're busy as a I'm using you an example, being a parent and being many hats to other people, it's nice to have someone in your corner to be like, "Yeah, did you remember to go to bed at 9:30 and, take your tea?"
Yeah, exactly. Yeah, and that's one thing, I'll just give you some praise. I've noticed that every time we talk, like, you do have that coaching mindset of, "Well, what do you eat for breakfast?" "I don't eat breakfast." "Well, what's something that you could eat for breakfast?" "Well, we have a lot of eggs because we have chickens." "Well, can you make some eggs for protein because you're lacking?" "No, I can't, because if I make eggs for myself, then all 4 of my kids that are still home are gonna want eggs." So now I've gone from making myself an egg to having to make, a dozen eggs for 5 extra people.
Mhm.
And it's like, okay, well, what's something that you can do? What is something achievable that you can do to get enough protein? "Well, I can make a shake." "Is that something you could commit to every single day?" It's like you worked with me. You didn't just berate me and say, "Well, you need to do it and you need to do this." You didn't tell me what I needed to do. You helped me, as a good coach does. You allowed me room to create my own solution, where I was coming up with it. And it's like, oh, this was my idea. Yeah, this is something that I can do. This is achievable, not just someone saying, you will get up every morning at 7 a.m. and make yourself 2 eggs. And it's like, then you don't want to do it. It's like, forget this. So,
Sure. That
but
was incredibly introspective. I love that, 1, you sound exactly like a nutritionist, so it's like you could step in that lens just the way that you've, been able to articulate that, but I'm so glad that that's been your experience, that, yeah, that was really nice to hear.
yeah. And that's why I had you on, because you've been a big help to me. And I just want to, in every experience that I have in getting better, I just try to share that with everyone else, just let them know that there is hope out there and just give them, some people don't even know what a nutritionist can do for them. And I didn't know until my wife said, you need to go see a nutritionist. And I was like, okay, fine. So that's what this is all about. But thank you
Yes,
so much for being here and sharing. I know you have
absolutely.
to run. I'm sure we probably didn't even touch on half the stuff that I wanted to bring up today, but we went in depth, and that's what's most important. So I really appreciate it.
Absolutely, Brandon. I think, I'm totally open to future conversations. If your audience has specific things they want to talk about in the future, I'll say one thing just because, um, as an ending note for people to just go and read more, which I would say two resources that I'm really excited about. One, a non-for-profit organization called Metabolic Minds. Great research out there on the we had touched on what can people do to cope with being on medications and maybe to help that effectiveness. We didn't really touch on how and the interventions. So that's a great resource to kind of look at that, to look at interventions. And there's videos, there's podcasts, it's really great work. So and then a doctor that is part of that non for profit, she is a great lens of two things. She's a psychiatrist, and she realized that as a psychiatrist for Harvard University, her patients weren't getting better on medications. And though she's not shy to prescribe and do her work, she noticed she wanted to be educated in nutrition because of all these pathways we just talked about. So she did. She is now both the clinical nutritionist and a psychiatrist, and has written the book Change Change Your Diet, Change Your Mind by Dr. Georgia Heed. And she really talks about these options, both from a nutrition lens, but the metabolic piece of how to lower blood sugar to get optimal brain energy and maybe even get off medications or lower the reliance. So that's what I'll leave your listeners to read on. There's plenty more people that are doing good work, but I'm really excited about those two.
Awesome. Well,
Yeah.
thank you so much, and I'll talk to you soon.
Talk to you soon. Thanks.
All right. Bye.